Hi, this is Dr. Nageshwar, Children Heart Specialist from Hyderabad. The important question which is arising is how to diagnose congenital heart disease. Are there any treatment strategies for these disorders? Yes, there are so many treatment options are available now. So if you look at how to diagnose the heart disease, as soon as child comes to us, we'll take a detailed history, how it happened, is there a heart failure, blueness, all those parameters. Then we'll check the blood pressure, pulse and saturation. If the saturation is good, that means there is no mixture of bad blood and good blood. If the saturation, that is oxygen percentage, is low, then that indicates that we are dealing with a blue baby. After that, we'll do a detailed examination using the stethoscope and find a murmur. Based on that, we'll advise chest X-ray or ECG, and most of the cases will undergo this echocardiogram, that is nothing but a scanning of the heart. So in these tests, we'll see whether blood is excess to the lungs or less to the lungs, or is there any heart dilatation or heart function is good or not. These parameters we'll check it. Whereas in the echocardiogram, we'll directly see whether hole is there or not. If hole is there, what is the size of the hole and how much of blood which is actually flowing across the hole to the lungs causing heart failure. Are there any other additional defects like valve blocks or blood vessels which are changed? Based on all this information, we'll come to some diagnosis. In some cases where they come later part of their life, it is too late to come. However, we may have to do some tests like CT scan, MRI, and if necessary, angiogram, that is called as cardiac catheterization. So in all these tests, we'll check the various saturations and pressures in the heart and come to a definitive understanding. Once we come to the diagnosis, then we all will sit and then discuss about the case and we'll plan the proper treatment for that particular child. So in terms of treatment modalities, so many heart diseases are there. Each disease will have different operation. For an example, there is a condition called hypoplastic left heart syndrome that we diagnose before birth itself. That means during fetal life. As soon as baby is born, we do operation called Norwood kind of a surgery. For conditions like pulmonary valve stenosis, we do balloon dilatation. So based on the type of heart disease, we will decide whether we have to do complex heart surgery or a simple surgery first and then definitive surgery, or sometimes holes will put a plug there, that is called as a device closure, or sometimes we put a balloon and then open the valve. This is called as balloon valvuloplasty. Based on the type of the condition and seriousness of the heart disease, we decide. Some children, they don't need this kind of operations or procedures at all. They will just improve spontaneously, naturally, with the support of medications called diuretics and very rarely ACE inhibitors. So that's how we actually diagnose and treat all these congenital heart disease. Every day they are coming to our hospital. Thank you very much for watching our news.